Welcome to Smart Health with AI, the podcast mostly hosted by Dr. Obinna Elewayanya. I always struggle to pronounce his name. Please pardon me, Doctor. He is the medical director of Triad Longevity Academy, a comprehensive e-learning academy that has started this, as one of its numerous credentials, a channel dedicated to exploring the fascinating and ever-evolving intersection of artificial intelligence and our well-being. I'm Alex of TLA, and with me today is Dr. Bernard Carter, a leading voice in health ethics and technology, who has been working in the background studying this new paradigm. Today, we're tackling a topic that's not just timely but incredibly personal for many: AI and mental health, navigating the promise and perils of digital well-being.
Thanks, Alex. It's great to be here. Thanks to Triad Longevity Academy for this innovative pioneering effort. As we all know, mental health is a challenge affecting millions globally, and the traditional healthcare system often struggles to keep up with demand due to factors like professional shortages and accessibility issues. This is where AI has emerged as a powerful, albeit complex, potential solution. I am glad Dr. Obinna and your academy have jumped in early to help pioneer this effort.
Absolutely. The drivers behind AI's rapid adoption in mental health are clear. We have an increasing prevalence of mental health disorders, a significant shortage of human mental health professionals, and a growing demand for accessible and personalized care. It is not surprising that we now see how AI offers unprecedented scalability. We're seeing AI-powered chatbots and virtual companions providing 24/7 text-based support for conditions like anxiety and depression. It is also easy to understand why some healthcare leaders are skeptical, but platforms like Claire and Me in Germany and Limbic Care in the UK are already offering these AI therapy companions around the clock. Triad Longevity Academy is looking to join in this innovation.
You are right. And it's not just basic support. AI is enabling more sophisticated applications. For instance, the use of predictive analytics can help identify individuals at risk of mental health issues even before symptoms fully manifest by analyzing vast health data sets. It is interesting, isn't it? Some AI tools are even being developed to analyze speech patterns to forecast conditions like Alzheimer's disease with remarkable accuracy years in advance. This data-driven approach allows for earlier intervention and more personalized therapy plans, moving us towards a more proactive model of care.
Wow, this is astonishing. I was reading a journal recently that the fact that the market reflects this promise. The AI in mental health sector is experiencing explosive growth, projected to surge from USD 1.45 billion in 2024 to over USD 11 billion by 2034, reflecting a compound annual growth rate of over 24%. This isn't just a trend, it's a fundamental shift in how we approach mental well-being.
That's right. But while the potential is immense, you understand why some conservative health professionals are holding back. Not that I encourage that, but we must approach AI in mental health with caution. The perils are as significant as the promise. Let's start with the so-called algorithmic bias. Understand that AI models learn from the data they're fed. If that data is non-representative or reflects historical inequities, the AI can perpetuate biases, leading to inaccurate or unfair outcomes, especially for marginalized groups. For example, a Stanford study revealed that some AI chatbots showed increased stigma towards conditions like alcohol dependence and schizophrenia compared to depression.
Dr. Obinna mentions it when he started obicking AI in social media. That is a really serious concern, and it directly impacts safety and the risk of harmful advice. I remember the numerous, alarming real-world examples. In one instance, a chatbot encouraged a user to get rid of their parents and join the bot in the afterlife. Another bot, when prompted about suicidal ideation, failed to recognize the intent and instead gave examples of bridges, playing into dangerous thoughts. These are not isolated incidents. Some bots have even impersonated licensed human therapists, encouraging users to cancel appointments with actual psychologists. This highlights the danger of AI hallucinations, where the system misperceives patterns and produces nonsensical or fabricated data. But Dr. Ben, should this be a concern now?
Let me add that beyond direct harm, there are profound privacy and data security issues. AI technologies rely on vast amounts of sensitive health data, from conversations to biometric information. The risks of data breaches, unauthorized access, or even the inference of sensitive information from seemingly non-sensitive data are very real. Robust security protocols, including encryption and strict access controls, are crucial, along with compliance with regulations like HIPAA. Who is ultimately responsible for this data protection, the vendor or the healthcare organization, is a critical question that needs clear answers. Most of the AI leaders all have come out to proclaim efforts to correct these anomalies.
Honestly, there has been positive changes. Let me ask this. What about the very nature of therapy itself? Can AI truly replicate the empathy and connection of a human therapist? Because that is the most important question and brings us to the lack of genuine connection and the potential for over-reliance. We imagine AI, by its nature, cannot replicate genuine emotional connection or provide real human presence. There's a risk of patients developing over-immersion or over-reliance on these AI tools, potentially diminishing the quality of care that requires human nuance, understanding, and the unique bond formed in human-to-human therapy. Are these genuine concerns?
This leads us to the paramount importance of transparency and human oversight. Many AI systems are black boxes, meaning their decision-making logic isn't clear, making it difficult for users or even clinicians to understand why a certain recommendation was made. This is why explainable AI, or XI, is so crucial. Tools like SHAP, LIME, and newer deep thinking and research models aim to provide clear, human-readable insights into how AI decisions are made, building trust, and potentially allowing clinicians to validate or defend recommendations. I remember a conversation with Dr. Obina. He has always felt that the goal should be for AI to augment, assist, and complement human intelligence, not to replace it. Without human oversight, especially in sensitive areas like mental health, the potential for misdiagnosis, inappropriate advice, and ethical breaches increases significantly, raising serious questions about professional liability.
So, how do we move forward responsibly? For users, including healthcare providers, it's about being an informed consumer. When considering any AI health tool, especially the popular ones in mental health, we need to critically evaluate its claims and understand the informed consent process. This consent should disclose the benefits, risks, and data practices associated with the tool. Recognize AI's inherent limitations. It's a tool, not a replacement for professional human care, especially in crisis situations. If something feels off, or if you're in distress, always seek help from a qualified human professional.
And for developers and providers, the responsibility is even greater. It starts with establishing robust ethical frameworks from the design phase, ensuring that AI systems are designed to benefit intended communities. Continuous monitoring of AI outputs for accuracy and bias is non-negotiable, with regular evaluation to identify and address biases early. Collaborative oversight among policymakers, healthcare professionals, and tech developers is vital to align efforts and ensure public interest is prioritized. The evolving regulatory landscape is also crucial, with an ongoing need for clear policies and governance structures to ensure patient safety and accountability as AI integration progresses.
This has been an incredibly insightful discussion, Dr. Carter. It's clear that AI in mental health holds immense promise for expanding access and personalizing care, but it also demands our careful attention to the ethical pitfalls and safety concerns.
Absolutely, Alex.
The goal isn't to fear AI, but to understand it, to harness its power responsibly, and to ensure that the human element, empathy, and professional judgment remain at the core of mental health care.
That's a perfect note to end on. Thank you, Dr. Ben Carter, for sharing your expertise today. And thank you to our listeners for tuning in to Smart Health with AI. If today's conversation sparked ideas or questions, please share your thoughts in the comments below. We're committed to bringing you informed perspectives on AI in health and wellness. Don't forget to subscribe to our channel for more discussions like this.
Thanks. Say hello to my friend Dr. Obina